Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is a patulous eustachian tube? Patulous eustachian tube, PET, occurs when the eustachian tube, which connects the middle ear to the back of the throat, stays open. Though rare, it is not a serious medical condition. It does, however, cause annoying symptoms, including tinnitus, a sense of fullness in the ear, and hearing your voice and breathing. /r/n/r/n Under normal circumstances, the eustachian tubes stay mostly closed to protect the inner ear from bacteria, viruses, and fluid. The tubes briefly open once or twice an hour to equalize pressure and drain fluid. With PET, the tube malfunctions and stays open even when it doesn't need to. /r/n/r/n This article discusses patulous eustachian tube. It explains the symptoms and causes of this eustachian tube dysfunction. It also explores treatments for PET and how drinking enough water may relieve symptoms. /r/n/r/n If you're experiencing PET, you may have one or more of the following symptoms. /r/n/r/n Autophony is the classic, hallmark symptom of a patulous eustachian tube. It is a condition in which you hear unusually loud feedback from your own voice, breathing, and heartbeat. /r/n/r/n Autophony is a symptom seen with other disorders involving the ear, such as superior semicircular canal dehiscence, an abnormal opening in the ear canal. The semicircular canals are complex, bony tubes of the inner ear involved with balance. If the bone is absent in a spot, the inner membrane is exposed to the middle ear and pressure changes can cause symptoms. /r/n/r/n The causes of PET are what medical professionals call idiopathic, meaning they are of an unknown origin. However, there are several factors that may predispose you to develop chronically open eustachian tubes, including /r/n/r/n Mild PET symptoms may not require treatment. You may find that sniffing or lowering your head can cause some temporary relief of autophony. /r/n/r/n However, if the symptoms are severe enough and have persisted for more than 6 weeks, then you will want to start treatments focused on resolving patulous eustachian tube. /r/n/r/n First-line treatments for PET include the following non-invasive treatments: /r/n/r/n nasal decongestants and steroidscommon treatments for other inner ear conditions can make PET symptoms worse. /r/n/r/n Over-the-counter decongestants to avoid include /r/n/r/n steroid nasal sprays to avoid include /r/n/r/n when less invasive methods prove insufficient to resolve symptoms of patulous eustachian tubes. Surgical treatments may be more effective. /r/n/r/n Keep in mind that there is no universally accepted approach for PET treatment, and management strategies often are not as successful as healthcare providers and their patients would hope. /r/n/r/n Patulous eustachian tube, PET, occurs when the eustachian tube remains open. You may not know you have it unless you are experiencing some red flag symptoms. These include the feeling that your ear is clogged, experiencing a ringing sensation, a condition known as tinnitus, or hearing your own voice in your ear, autophony. Of the three, the latter is the hallmark symptom of PET. /r/n/r/n The cause of PET is unknown, though it's thought that certain habits and conditions may predispose you to it, from using nasal decongestants to dropping a significant amount of weight quickly. /r/n/r/n Many physicians turn to non-invasive treatments first. These usually involve proper hydration in some form. The most common invasive treatment involves the placement of a tympanostomy tube in the ear. It holds the ear open, provides ventilation, and allows excess fluids in the ear to drain. However, this procedure is effective only about half the time. /r/n/r/n rxcardclub.com Get a free prescription drug card and save up to 80% on prescription drugs.